And all sulfur which I have seen for the last 5-7 years, let it be dengue, let it be headache, let it be fever, let it be malaria, let it be any acute state, they have this thing as a trait following. And I am telling you, try this. It works. Next day the patient has to tell you, I am feeling better. It works more than your injections of paracetamol and for that matter anything. You should not search the rubrics. Huh? You should search the state. Disturb hours to be. Irritability, pain during. Peace, repose and tranquility desires. Peace, repose and tranquility desires. And cares others for. And in this state, if you put any other rubrics of sulfur, they will match. You ask him, it will match. If you can get this state. Am I clear to you? Use this clinically and see what results you get. I am sure 100% of the cases should come out unless until you have not stamped the rubrics. You have got the rubrics. Okay, you should see the rubrics in the person. Huh? But Briania may the caring part is not that much. He'll be disturbing you. He'll be disturbing you. The caring part is very typical about sulfur.
Sir, because Briania patients in acute state are so much they don't want to do, just want to lie.
Yeah.
In that condition,
but they will be telling you. No. They will be complaining to you. Maybe ye la ke do. Give me that. Give me the covering. Give me this. Here he will not tell you. You ask the attendant, since the time he is not well, what he wants that you should do. He'll say, no, he doesn't want that I should come near her. Then you ask the patient also. For like, there was a case of appendicitis. I think I had shown this case. The patient was having severe pain. He was told to get it operated. His wife is a doctor. And whole night he was writhing in pain and he never bothered to wake up his wife who was sleeping next. So next day morning the wife gets the patient to me, her husband to me, saying that we don't want to get him operated. We want that we should solve it with homeopathy. And I talked to him a lot. He was so mild and everything, months because he was having pain. And one question I asked him, when you are in severe pain, what do you do? He says, I just lie down. I don't want anybody to disturb me. Then I asked him, but your wife is a doctor. You had so much pain. I think she would have given something better rather than you thinking yourself of just lying down to make you feel at ease. Maybe she wouldn't have taken, she didn't have a fear of getting operated. But whole day she is working, seeing patients. You understand? And then night she comes and that is the only time she sleeps. It's not good to disturb her, isn't it? You understand? He didn't bother to disturb a doctor who's lying legs next to him. That much care he has for his wife during the problem. That is typical. You understand? It has to come from words. You should not interpret it. And that is sulfur.
Sir, didn't it came in your mind why sulfur behaves in such a way?
That I should think about it. Maybe after I call all those people who have been treated with sulfur this way, I'll ask them why they develop that way.
Because it came in my mind. I'm just trying to answer my question myself.
You can get an answer to this. I'll tell you a game how to get this thing. Go home and try. Take the laptop or your repertory. Put cares others for. And then go to the mind section and see why anybody will care for somebody. And don't see because. Search for the rubrics which will complement the caring. And then you will get all those rubrics which will complement the caring part and go on adding it from sulfur. And then you will see a reason that is developed. Because he doesn't like people should get disturbed, it is for good opinion of others or whatever. And you will see these are the reasons why sulfur doesn't care. This is one way, or other I get it for you. This is what I used to do maybe 5 years ago. Like suppose one is caring. Like if you have fear death of or any kind of fear, you for that matter. Why is he scared? Why he should be scared? For that matter, you take stramonium. Why he has to have fear of darkness? Then you see all the rubrics that are complemented and go on putting them together. You can take it from any repertoire. It can be Fatak or it can be complete. And then you will get a state developing. And if you get a single drug rubric which complements the fear, you add these two rubrics, that becomes a state. And if you see these two things coming together in a person, give that remedy, it works. Blindfolded, irrespective of what the pathology is.
Example, sir?
Example I'll tell you. Then I have to get it from my patients. A patient comes to you, and generally patient will tell you the chief complaint first. This happens to me, that happens to me, it's paining me, it's killing me, all those adjectives about the pain and the problem, he'll finish it off. Then you diagnose the case, whatever it is. Then this generally happens either when the patient starts the conversation or when he's about to leave your cabin. Actually, doctor, you know why I came to you? You ask him, why you came to me? I had been to a surgeon also 2 days ago. He told me that I have to get it operated. And I am very scared of surgery. It is not about a surgery, but I don't know that if after doing the surgery will I be okay. So I thought it's better that I come and consult you. At least you will be able to tell me. But can you tell me, doctor, that after the surgery I'll be alright, or after taking these medicines I'll be alright, or will this thing come to me again? Can you guide me in this thing? I want to know everything about this before I decide about this thing. If you take fear injured of being, fear dark of, and light desires, stramonium, and give stramonium, it works. What is the darkness? That he doesn't know anything. You understand? Doesn't know anything. And why he's come to you? So that you throw a light on it, so that he starts knowing. You understand? What is injury? That what the surgeon is going to do. Give stramonium, it works. It has to work, there is no option. See, basically then you don't know, you're treating the state. Good, this will answer your question also. You're treating a state or the constitution. Everybody of us will have a state at any given moment. Right now also, we all have a state. But at that particular situation, some of our state develops, irrespective of whatever it is. And if you can pick up the state and treat the state with a lower potency, the physical problem also disappears, the state disappears. Next time the patient comes, you can see the thing obviously. Another typical constitutions which I tell you, which are 100% results. Like, there are some set of patients. I tell you some set of patients, how they behave in my clinic. Doctor, my case is written in the same paper or what? No, it's a different paper. No, I thought maybe he must have given it by mistake, that my wife's paper to you, because it is also written Mrs. Narang only. So is it Mr. Narang or Mrs. Narang? No, I show it to him. This is Mr. Narang only. Okay. Then after this is examined, he'll say, will he be able to understand what you have written? The person who makes the medicine. Okay. He's used to, because he's trained and we do a training procedure. No, I just asked. Don't know if they don't give the medicine properly. Then I may not be alright. This is second thing. Then will I be okay, or will I have to come again for this? Because last time also I went to another doctor. He said that I'll be okay, but then it doesn't get cured. I have to go again and again. What is the thing that is happening there? And there is a fear that this person may betray you. So what is the drug? दे दो. Alzheimer's. Kill desire. I want that this thing should come from the root. I want that this disease should get finished out of me. I want to get it out of my system. Kill desire to. Give Alzheimer's. It works. It works. You just take this for, if you can find it, don't stick on it. If you stick and if the rubrics don't come out of the feeling, words, it may not work. But if it comes from the feeling words and if you use it, it works. Again, I'm telling you, you're treating the state. It may not be the whole constitution, but the patient is relieved irrespective of whatever the pathology is.